ITN Productions is delighted to be partnering with Alzheimer's Disease International, and I'm joined now by ADI's CEO Paola Barbarino. Wonderful to meet you. Thank you for coming in. ITN Productions very excited to be working with you. What are you hoping to achieve out of this new relationship?
Thank you, Natasha. It is wonderful for us to be able to be here with you. One of the biggest issues we have at ADI is to raise awareness globally about dementia. The stigma surrounding dementia is still huge, and it is only by opening up to wider audiences that we can really try and tackle it.
So stigma is one thing we're going to be discussing. The programme is called Every 3 Seconds. What does that mean? Why are we discussing that?
Every 3 seconds, somebody in the world develops dementia. So if you think about it, it's the time it takes to pour a glass of water or to answer the telephone. It's incredible. It's a huge number of people. We estimate that in 2050, there will be about 130 million people globally with dementia. If you think about this number, it's mind-boggling. We do need to highlight the issue of the social, human cost of this emergency, and the best way to do that is to highlight how big the issue is going to become.
The figures are startling, but what's even more extraordinary is that progress is so slow in trying to tackle dementia. Why is that?
The stigma surrounding dementia today is still enormous, and this means that people are not demanding for a cure, they're not demanding for answers, and so the research money going into developing a form of cure or innovation is limited.
That's extremely interesting that you should say that that's one of the drivers, because as far as I know, there's no cure. So it's very difficult to build an argument for investment, isn't there, if there is no cure available?
Yes, dementia is actually the biggest disease globally for which there is no cure. And there is no doubt that there are a million of people, we estimate about 50 million people now with the disease. But at the same time, the societal cost of the disease is enormous. Think about all the families that currently have a person with dementia in their family. Think about everybody in your neighborhood. You will know at least a few people that are coping with it now. This is a cost that we cannot underestimate, and this is a cost that governments cannot underestimate. We estimate that this year the disease will cost globally $1 trillion. This is bigger than the GDP of some countries put together. Now, we cannot ignore this. There is sense in doing something about it together. We cannot, this is not something that we can swipe under the carpet and hope it will go away. We need to take action now.
Building awareness obviously is the first step. How do we fit in this country into a global pattern?
So, well, England has been one of the leading lights behind the movement of Alzheimer. In fact, the founders of ADI are the UK, the US, Canada and Australia, which were amongst the first countries that acknowledged that there was a problem, and amongst the first country where civil society was formed to tackle it. In part, ADI is a movement of solidarity globally. We are about also developing country voices. We help them build up a capacity. There is a lot of people in the Alzheimer's Society, for example, in England, that help people in smaller countries. And this is the case for all of our membership. Countries that have examples to share them. And it doesn't matter if these are big examples or small examples. It's all about learning together, and it's all about raising awareness together.
Let's talk about the dementia plan. The World Health Organization has adopted it. What does it mean?
Well, this is a real great opportunity for us to enter a completely new era in dementia globally. So if you think about it, up until now, we have never had a legal instrument that would effectively oblige governments to take action about dementia, and now we do. All countries in the world have signed unreservedly the Dementia Action Plan. That means that effectively we can go and demand some action to be taken for the benefit of people with dementia, their family, their carers now. However, we at ADI can do it from the top up. We can go and speak to governments, we can go and speak to these giant organizations globally that do decide what is being done or not in the field of healthcare. However, it is only by building a movement from the grassroots up that we can effectively achieve change. We need people globally to go and ask at the local level, at the regional level, at the national level for something to happen. And these will in turn convince governments to take action, and that action, we hope, will make life better for people with dementia, for their family, for their carers now. Because at ADI, we do have this as one of our key principles. Life can be better now whilst we wait for a cure for tomorrow.
You've got great aspirations. 2018 has a lot of challenges for you. How will you see it as a success?
Well, I think that if we manage to increase some of the awareness through opportunity like this would be wonderful. We will also start focusing much more in depth on certain issues that we know are going to make a great difference. For example, there are certain countries like China, like India, like Brazil, where we know that if we make some progress with the local governments, this could escalate in changes to the life to millions of people. We are also going to focus a little bit more on innovation, and innovation not just for research but also for care. A lot of what we do at ADI is about promoting care for people today whilst we are waiting for a cure for tomorrow. So there is a lot that people can do, and it doesn't have to cost the heart. We can create a movement of people that are helping each other now.
We look forward to following your progress throughout the year ahead. Thank you so much, Paola.
Thank you, Natasha.